4 years ago today, the World Health Organization declared COVID-19 a pandemic. While some people recover within weeks or months of contracting COVID-19, others are dealing with long-term side effects years later. They're living with what's become known as long COVID, and they're being seen by Arkansas medical students at the only clinic dedicated to treating their symptoms, which is located right here in Northwest Arkansas. Step inside the only long COVID-19 clinic in Arkansas, located off North College Avenue in Fayetteville.
So there's a big need for this, and coming from all over the state.
The clinic is run by the University of Arkansas for Medical Sciences.
Long COVID is still in the makings of what exactly is it? How can we diagnose it? How can we help it?
The research says that up to 15 to up to 30% of people who get COVID-19 will later go on to develop long COVID.
Dr. Christopher Walter, an assistant professor at the College of Medicine, describes long COVID as symptoms lasting 3 weeks or more after a positive test. Since September 2022, doctors have seen about 70 patients here.
We have a really long wait list.
UAMS students like Harrison Ballard, who's in his 4th year of medical school, work alongside medical professionals to evaluate patients.
It's a very difficult thing to actually diagnose, because you really are just ruling things out before you get to that diagnosis. When it's something that everyone in the scientific body as a whole is learning about as we go. You know, it's not something that's cut and dry.
And Ballard says fatigue is one of the most common complaints.
It's not just like, oh, I'm a little tired, I feel a little more tired than usual, maybe I'm having to consume more caffeine than usual. It's like, no, I feel like I have no energy at all. I feel like I am a shell of the person I used to be. It's very dramatic for most people when they come in.
Trouble breathing, brain fog, muscle weakness, anxiety, and depression are other symptoms often overlooked, according to second-year physical therapy student Cambry Autry.
You know, a lot of times this is the first time they're actually being heard for everything they've been dealing with.
The clinic takes a holistic, interdisciplinary approach to treating each patient.
We've got students from physical therapy, occupational therapy, med students, pharmacy students, nursing students, and they all kind of rotate through this clinic at some point.
Students from these 5 different specialties make up a 5-person team, viewing a single patient through multiple lenses.
The nursing student will take vitals, the pharmacy student, will maybe talk about medicines that the patient's taking, and then the medical student usually leads kind of with the history taking and the physical.
As a physical therapist, we really look at more of preventative care, how can we help you with, mental fog or your endurance, things like that they've been struggling with.
From there, the students develop a plan of care.
We go in and present to faculty, be like, hey, this is our plan, this is what we think is important, and then we go back to the patient and be like, hey, this is different ways, different strategies we can go to help you with.
Dr. Walter says it mainly comes down to helping patients manage their symptoms.
We teach them how to pace or energy conservation, right? Teach them about diet, anything that can kind of help maintain or improve their symptoms as they go forward. There are many studies that are undergoing right now, kind of looking for that magic drug or the magic protocol, whatever it is.
Until then, the students and medical professionals are developing different treatment methods in real time.
We're kind of creating the research, within this clinic as we see patient to patient.
I think it takes you really being on your toes, working as a team, and really making sure the management we're giving is following the current guidelines.
The Long COVID Clinic serves as a one-stop shop for patients.
We're all minds working together. We're able to present different strategies to help out the patient. Whereas they don't have to drive to another clinic, they don't have to get in their car, they don't have to wait another month. They get seen right there.
By the time they make it here, many have already seen their primary care doctor and several specialists with no relief for the symptoms. And some finally leave here with an answer.
Not only are we able to kind of serve the community and the people with long COVID, but we're also exposing our students to this ever-changing and novel disease process.
While the students walk out with the experience of managing a novel virus.
To feel trusted, to build that confidence in their ability to formulate their own plans and their own judgment, and then present that in a concise manner. I think that's super invaluable for a student, and I think that's something this clinic gives you that is really valuable.
Dr. Walter says adults are seen at this clinic, but his team has seen patients as young as 18 all the way up until their mid-80s, with the average age of people there just shy of 60.